Hello, my name is Pearl Ainabe, a DMP student at Bradman University, here to present my health communication campaign on fetal alcohol spectrum disorders.
This program is presented by the Centers for Disease Control and Prevention.
If you're pregnant or might get pregnant, you can start taking care of your child long before birth. Drinking alcohol during pregnancy can have permanent negative health effects on your developing baby. Fetal alcohol spectrum disorders are caused by drinking during pregnancy and involve physical, behavioral, and learning problems in a baby that last a lifetime. Because there is no known safe level of alcohol consumption during pregnancy, if you're pregnant or might get pregnant, don't drink. Fetal alcohol spectrum disorders are 100% preventable if alcohol is not consumed during pregnancy, so why take the risk? Thank you for joining us on A Minute of Health with CDC.
For the most accurate health information, visit www.cdc.gov or call 1-800-CDC-INFO.
This program is presented by the Centers for Disease Control and Prevention.
More than 3 million women in the U.S. are at risk for exposing their developing baby to alcohol. Drinking alcohol during pregnancy can cause physical, behavioral, and intellectual disabilities that can affect a child's whole life. These disabilities are known as fetal alcohol spectrum disorders. About half of all pregnancies in the U.S. are unplanned, and even if planned, most women don't know they're pregnant until 4 to 6 weeks into the pregnancy, which means they might drink alcohol and unknowingly put their developing baby at risk. Women should avoid drinking alcohol if they're pregnant, trying to get pregnant, or could get pregnant. Healthcare providers should offer alcohol screening and counseling to all women and advise women who are trying to get pregnant to stop drinking. For women who consume alcohol and are sexually active, providers should recommend birth control. To learn more, visit cdc.gov/vital signs.
For the most accurate health information, visit cdc.gov or call 1-800-CDC-INFO.
FASDs are a wide range of physical and/or behavioral issues experienced by an individual whose mother drank while she was pregnant. Those physical issues include low birth weight and growth, problems with heart, kidney, and other organs, damage to parts of the brain, which leads to behavioral and intellectual disabilities such as low IQ, poor reasoning and judgment skills, poor ability to communicate in social situations, hyperactivity, which results in problems at school, problems with living independently, substance abuse, keeping a job, and even trouble with the law. Some of the FASD issues include poor reasoning and judgment skills, vision or hearing problems. When a woman drinks, her baby also drinks. A survey done between 2015 and 2018 showed that about 10% of pregnant women reported to have had at least one alcoholic drink in the past 30 days. From this chart, you can see that at 3 weeks, the brain starts to develop. So there is no safe amount of alcohol that can be consumed while pregnant, and there is no safe time to drink alcohol while pregnant. So the solution is do not drink while pregnant or if you're planning to become pregnant. This is Tisha, a 20-year-old who is trying to teach others how to survive with fetal alcohol spectrum disorder. She has problems with remembering things. She has problems with reading and writing, but she's trying to survive and live to her full potential. Fetal alcohol spectrum disorders are lifelong, so the solution is do not drink while pregnant. This is a brochure for the public. This is a brochure for pregnant women or women planning to become pregnant. It discusses what FASDs are. It discusses the causes of FASD, and it emphasizes not to drink. It talks about the fact that you cannot have a safe amount of alcohol. There is no safe limits. There is no safe time to drink. It also talks about the treatment for people with FASDs. There is no cure for FASD. However, early intervention can help mitigate the problems with FASD. Also, this brochure talks about what you can do if you suspect that your child has FASD. It talks about who to contact, and also has helpful resources such as NoFAS. It has the number for NoFAS and the web address for NoFAS. It has information about CDC, how to access CDC. It has Alcoholics Anonymous, March of Dimes, and other resources here for a parent who wants to have, for a parent or an individual who wants to get more information about FASD. The solution is do not drink while pregnant or if you're planning to become pregnant, because pregnancy and alcohol don't mix. When a woman drinks, the baby also drinks. Here are my references. Thank you for listening.